Okay, again, very good mornings to all of my dear viewers. Uh, in this session, I am going to discuss again very important topic of community medicine, and the name of topic is dengue fevers. So, without any delay, we start the session. So first, I would like to talk some common point related this dengue fevers. So what is the common point? The first thing is that it is a viral disease, and there are four serotypes of this dengue virus. Then one, two, then fourth, and there are two vectors through which this disease is transmitted from one person to another person. One is Aedes aegyptius and another is Aedes allopicticus. So Aedes aegypti or Aedes allopicticus, yeah, these are the two common vectors that are responsible for the transmission of disease from infected person to healthy person. So after sharing some common things about this dengue fevers, now we go in detail of dengue fevers. So in this video, in this video I talk for features, clinical features of dengue fevers. In next video, I will talk about its management. So let's start. So according to the WHO classification, WHO classification, what they do? According to the WHO classification, they divided the dengue fevers into the two categories. What two categories? They divided the dengue fever into the two categories. One is undifferentiated fever. One is undifferentiated fever, and the another is differentiated fevers. One is undifferentiated fevers and another is differentiated fever. So basically, what is the meaning of this undifferentiated fevers and the differentiated fevers? When we talk about the undifferentiated fevers, this undifferentiated fevers means patient having a fevers, but this fevers is not associated with any classical symptoms of dengue fevers. I mean dengue fever, whatever the pronunciation. So in undifferentiated fevers, the patient having a high fevers, but this high fever is not associated with any classical features of dengue fevers. But in case of differentiated dengue fevers, here person having fevers and also this fever is associated with the classical features of dengue fevers. So in further this differentiated dengue fever is categorized into the two categories. One is the classical dengue fevers, one is the classical dengue fever, and another is dengue hemorrhagic fever. Dengue hemorrhagic fever. So this differentiated fever is further categorized into the two categories. One is the classical dengue fevers and another is dengue hemorrhagic fever. So what happens? How we differentiate a person having a classical dengue fevers or dengue hemorrhagic fever? Let's see why we classify these different dengue fever into the different categories, because their management are different. So first we having a clear cut idea about the patient having a which types of fever, or they belongs to the which stage of the dengue fevers. So that's why this classification is very important to understand. So this differentiated dengue fever is further classified into the two categories. One is the classical dengue fevers and another is the dengue hemorrhagic fevers. Now the question is arises how we classify a patient having a classical dengue fevers or they having a this dengue hemorrhagic fevers. So let's see, both in a classical dengue fevers and this dengue hemorrhagic fevers having a febrile stage 0 to 5 days, in both cases having a febrile stages. So in febrile stages we can't differentiate between the classical dengue fevers and the dengue hemorrhagic fevers, because both in dengue hemorrhagic fevers and the classical dengue fevers both having a similar sign and symptoms. So what are the sign and symptoms that you see in case of classical dengue fevers and the dengue hemorrhagic fevers in the febrile stages? So first stage is the febrile stage, febrile stages. So this febrile stage क्या होता है? This febrile stage is common in both classical dengue fevers and dengue hemorrhagic fever with similar sign and symptoms. So what are the value of fever? Generally it is lies between 39 to 41 degree Celsius. What are the other classical feature associated with this fever? The patient having headache and they having a classical headaches that is called the frontal headaches. Patient having a frontal headaches. Okay. So along with frontal headache, they also having a retroorbital pains. They also having a retroorbital pain. Okay. What are the other things? They having some common features like myalgia, arthralgia, and also associated with colicky abdominal pains. Also associated with the colicky abdominal pain, and then they having a maculopapular rashes with itching. Some patient the itching is seen in case of earlier stages, while some case patient the itching is seen in recovery phases. So itching are common in both earlier phases and recovery phases. What are the more features? The patient may having anorexia. Anorexia means anorexia means they having no any urge of eating, loss of appetite. We can say that it is the loss of appetite, loss of appetites. So these are the common features that you see in case of febrile stage in both classical dengue fevers and the dengue hemorrhagic fever. So these things are the common. Now the question is arise, how we differentiate this classical dengue fever with dengue hemorrhagic fevers? So we differentiate it in critical phases, because this classical dengue fevers there is no critical phases seen in case of the classical dengue fevers, while dengue hemorrhagic fevers they are associated with critical phases. In classical dengue fevers, after the febrile phases, the patient undergoes recovery phases. After the febrile phases, patient undergoes recovery phases. But in dengue hemorrhagic fevers, after the febrile phases, patient undergoes critical phase. Critical phase. Now the question is arise, what is the meaning of this critical phases? So the meaning of critical phase is, let's see what happened in case of classical dengue fevers. There is no any significant loss of plasma leakage. I mean there is no any significant plasma leakage occur in case of classical dengue fevers. But in case of dengue hemorrhagic fevers, there is severe damage of vascular endothelium. So due to this severe damaging of the vascular endothelial tissue, the vascular permeability will be increases. So if vascular permeability will increases, that leads to the severe loss of plasma fluids. I mean, they having a severe plasma leakage. So in critical phases, what patient having a significant plasma leakage, While in case of classical dengue fever, there is no significant plasma leakage. So on the basis of this significant plasma leakage, we can differentiate that a patient having a classical dengue fevers or they having a dengue hemorrhagic fevers. So what happens if there is a significant plasma leakage will occur? If having a significant plasma leakage will occur, that leads to increase the hemo concentration. This hematocrit level will rise greater than 20%. Hematocrit level will rise greater than 20%. Also, in case of dengue hemorrhagic fevers, patient having a very low platelets count. Its platelets count is less than 1 lakh. Platelets count is less than 1 lakh. While in case of this classical dengue fevers, there is no significant plasma leakage, no significant plasma leakage. So if there is no any significant plasma leakage, so hematocrit level is either normal. Hematocrit level is either normal or slightly elevated. Okay. What about this platelets level? Platelets level is obviously less than normal, but this platelets level is not less than 1 lakh. So having less platelets level, but not less than 1 lakh. So on the basis of these two symptoms, we can differentiate a patient having classical dengue fevers or they enter in the critical phase of dengue hemorrhagic fever. For confirmation, what we do? For confirmation, we go for the X-ray. Because if there is a significant plasma leakage, if patient having a significant plasma leakage, then this plasma are also accumulated in pleural cavity. So if now there is accumulation of excess fluid inside the pleural cavity, the condition is called pleural effusion. So when we go for the X-ray, we observe that a patient having a pleural effusion. So this pleural effusion conclude that patient having a dengue hemorrhagic fevers, and this pleural effusion is due to the significant plasma leakage. So on this basis, we can differentiate dengue hemorrhagic fever from the classical dengue fevers. So this is all about the clinical features of dengue hemorrhagic fevers and the classical dengue fevers. Now what happens? This dengue hemorrhagic fever is further divided into the two more subcategories. This dengue hemorrhagic fever is further divided into two more categories. So what are the two more categories in which this dengue hemorrhagic fevers is further classified or categorized? Dengue hemorrhagic fevers. What I am telling to you, in case of dengue hemorrhagic fevers, what happens? There is the significant plasma leakage now. If there is a significant plasma leakage will occur, obviously blood volume get reduced, and if blood volumes get reduced, then which condition the patient will go? They definitely undergo the shock condition. So on the basis of shock, this dengue hemorrhagic fever is further classified into the two categories. Each patient undergoes a compensated shock or the decompensated. So depending upon the amount of the plasma leakage, if patient having a severe plasma leakage, then definitely they undergoes a decompensated shock condition. Leakage but not so severe, so it is a condition of compensated. So on the basis of plasma leakage, this dengue hemorrhagic fever is further categorized into compensated shock, and decompensated. So what are the criteria on this basis to be? We can say that, or we can classify that patient having compensated shocks or the decompensated shock. So first parameter is obviously systolic blood pressure. So if patient whose systolic blood pressure is normal, what is the normal value of systolic blood BP? It is lies between 90 to 120 mmHg. So the first criteria is if a patient having a normal systolic BP, that means his or BP is lies between 90 to 120 mmHg, then we can say that the patient is in compensated condition. What are the other things? The other things is diastolic blood pressure, they get elevated. So why this diastolic blood pressure get elevated? Let's see what happens if there is a significant blood volume loss now. So body what they do? What are his first priority? His first priority is that to supply the blood significant, I mean vital organs of our body. So they constrict the peripheral blood vessels. So if they constrict the peripheral blood vessels, there are more blood supply to the vital organs. But what are the disadvantages? Due to the peripheral vasoconstriction, they increase the peripheral resistance. So if peripheral resistance is increases, that increase the diastolic blood pressure. So these are the 2 points. What are the third points? Third point is the patient in a tachycardia condition. Tachycardia. Okay. Tachycardia is for more cardiac output, so they fulfill the tissue demand. After that tachycardia, the patient having a pulse pressure. Pulse pressure is less than 20 mmHg. This drop in pulse pressure is due to the rise in diastolic BP, because what is the pulse pressure? Systolic minus diastolic now. So if diastolic value will be increases, obviously the pulse pressure get reduced. So after pulse pressure, there are one clinical sign. What is the clinical sign? Patient having a cold extremities and clammy. Why patient having the cold extremities and clammy? Because no, there is peripheral vasoconstriction. So if no blood supply in peripheral region, no warm blood reach to the peripheral region, obviously the skin that you feel cold. And why it is clammy? Because there is a stimulation of the sympathetic nervous not sympathetic nervous system, parasympathetic nervous system, and this parasympathetic nervous system stimulation that stimulate the sweat gland. So that's why a patient having the cold extremities with clammy, and there are some moisture seen over the skin. After that, they having a delayed capillary filling, delayed capillary filling. Generally, normal capillary filling is less than 2 seconds, but in case of shock condition, it is more than 2 seconds. What are the things happen in case of decompensated condition? In decompensated condition, the first is that here diastolics, not a systolic BP is less than 19 mm. Systolic BP is less than 90 mmHg. Or sometimes if its value is fall down beyond the 70 mmHg, if value is beyond the 70 mmHg, In that condition the BP are unrecordable. In that condition BP क्या हो जाएगा, unrecordable. What are the other things? Obviously diastolics BP will be high, patient having the tachycardia, and also cold and clammy condition, cold and clammy extremities. Pulse pressure is less than 20 mmHg. Hematocrit level is greater than 20%. Hematocrit level are also here greater than 20%. The major difference are seen in case of the systolic BP. If systolic BP is normal, then the patient in compensated stage. If systolic BP is less than normal, I mean patient in the hypotension stage, then we can say that patient enter into decompensated stage. So these are all over about the clinical features of the dengue hemorrhagic fevers. In next video, we are going to discuss its management. So good night.